Diabetes is a chronic health condition in which the body has difficulty producing or properly using insulin, a hormone that regulates blood sugar levels. Please consider subscribing. Insulin is produced by the pancreas and helps to move glucose, also known as sugar, from the bloodstream into the body's cells, where it can be used for energy. In people with diabetes, the body either does not produce enough insulin, known as type 1 diabetes, or the insulin that is produced is not used effectively, known as type 2 diabetes. This can lead to high levels of glucose in the bloodstream, which can cause a range of health problems over time. Symptoms of diabetes can include increased thirst and urination, blurry vision, fatigue, and slow wound healing. However, some people with diabetes may not experience any symptoms at all. Managing diabetes typically involves regular monitoring of blood sugar levels, making dietary and lifestyle changes to help regulate blood sugar levels, and taking medications. It's important to work with a healthcare provider to develop a personalized treatment plan for managing diabetes, as uncontrolled high blood sugar levels can lead to serious complications over time, including nerve damage, kidney damage, and cardiovascular disease. Some factors that increase the risk of diabetes are inherited from our parents or close biological relatives. If you have a blood relative with diabetes, your risk for developing it is significantly increased. Share your family health history with your doctor to find out what it may mean for you. If you're of African American, Asian American, Latino, Hispanic American, Native American, or of Pacific Islander descent, you have a greater chance of developing diabetes. The older you are, the higher your risk for prediabetes and type 2 diabetes. Type 2 diabetes generally occurs in middle-aged adults, most frequently after age 40. But healthcare professionals are diagnosing more and more children and adolescents with type 2 diabetes. If you develop diabetes during pregnancy, you are at increased risk of developing diabetes again later in life. Being overweight or obese increases your risk of developing diabetes. Losing 5% to 10% of your body weight, in addition to getting regular physical activity, can significantly reduce your risk of developing diabetes. Your risk decreases even more as you lose more weight. For most people, a body mass index calculator will provide a good target weight for your height. Physical inactivity is a key modifiable risk factor for prediabetes and type 2 diabetes. Regular physical activity helps lower insulin resistance. This means your body can use its own insulin more effectively. Even a brisk 30-minute walk at least 5 days a week has been shown to significantly reduce the risk of diabetes and heart disease. At least 150 minutes per week of moderate-intensity aerobic physical activity. Or 75 minutes per week of vigorous-intensity aerobic physical activity, or a combination of the two. And muscle strengthening at least 2 days per week. In addition to causing damage to the cardiovascular system, untreated high blood pressure has been linked to complications from diabetes. People with diabetes should maintain a blood pressure of less than 130/80ths of a millimeter Hg. Normal blood pressure is below 120/80ths of a millimeter Hg. Diabetes is associated with atherosclerosis, hardening of the arteries, and blood vessel disease. Low HDL good cholesterol and or high triglycerides can increase the risk for type 2 diabetes and cardiovascular disease. Following a healthy eating plan, getting regular physical activity and reaching and maintaining a healthy weight can help improve abnormal lipid levels. Sometimes, medications are also needed. If you smoke, there are a number of tools, medications, and online resources that you can use to help you quit. Talk to your healthcare team about the best options for you. It's important to eat healthy foods in the right amounts. Diet is one of the most important modifiable risk factors for prediabetes and type 2 diabetes. The American Heart Association recommends an eating plan that includes fruits and vegetables, whole grains, skinless poultry, fish, legumes, non-tropical vegetable oils, and unsalted nuts and seeds. A healthy diet should also replace saturated fats with monounsaturated and polyunsaturated fats, avoid trans fats, reduce cholesterol and sodium known as salt, and limit red and processed meats, refined carbohydrates, and sweetened beverages. Heavy use of alcohol can cause inflammation in the pancreas and limit its ability to produce enough insulin. Alcohol can cause liver damage and adds more sugar and starch to your diet that must either be used or stored as fat. That means no more than 1 drink per day for women or 2 drinks per day for men. Managing the stress in our lives is an important part of healthy living, not only for diabetes but for heart disease and many other conditions. Find ways to address the causes of your stress and make time for things you enjoy. Adults should get 7 to 9 hours of sleep a night. Sleep benefits your whole body, including your heart and brain. It improves mood, memory, and reasoning. Research also has shown that too little or too much sleep is linked to a high A1C in people with type 2 diabetes. If you have insomnia, trouble going to sleep or waking up too soon, or sleep apnea, problems breathing while asleep, work with your healthcare team to diagnose and treat them. Thanks for watching.